Hey, you guys, good morning. Good afternoon. But anyways, I was reading this article. I just found out about this. This is Gabapentin. The pill. The article is called "The Pill for Everything: Why Off-Labeling Gabapentin Prescriptions Are Soaring." So my mom has been on gabapentin. Gabapentin is used to control neuropathy. Now, um, they said that gabapentin is FDA approved to treat conditions such as seizures, pains, and it occurs with shingles. And gabapentin is a extended release version of the drug. Was FDA approved in 2011 for treating moderate to severe restless leg syndrome in adults. However, gabapentin is widely prescribed for off-labeled indications, everything from hot flashes to back pain. So this is the drug label was recently scrutinized by researchers of the Centers for Drug Disease and Control in Atlanta. A study published that the annual of internal medicine found the rate of gabapentin dispense approximately doubled from 2010 to 2016 and increased 2016 to 2024, though at a slower rate. So gabapentin dispensing was highest and continues to increase among older adults, with the researchers note may be due to the raise in off-labeling prescriptions for unexplained pain and other conditions among people 65 years or older. So you're talking about senior citizens, which my mom is a senior citizen. Um, it says the CDC researchers noted that that drug may rank even higher on the most prescribed list, as data used in the study did not include prescriptions dispensed outside of retailer pharmacies such as hospitals, long-term care facilities, and mail order pharmacies. So the biggest reason, I'm going to sum this up. The biggest reasons of why people take gabapentin, of course, is because of neuropathy. My mom has nerve pain, and gabapentin can cause severe dizziness. And for people who are have seizures, really have to be careful about this drug, because this is a fall for risk for people who are older, who are frail, and are not able to walk as well. So, when the FDA approved of this medication in back, let's see, it's 2025 that was came to reduce the nerve pain and was significantly more effective. Okay. And so there are a widespread of people who are having risk. Less than half of people prescribed gabapentin will not notice painful relief, but will experience side effects or adverse effects. FDA warns patients and doctors that serious breathing problems, even death, associated with the gabapentin with certain medications. As patients have excess sedative and or compromised breathing after gabapentin was combined with opioids or benzaprines, some people needed emergency care. This is one of the most important safety messages. And so some of the older adults have experienced falls or had to stop driving because of gabapentin, and that is very alarming, obviously. So he adds that doctors sometimes use gabapentin to treat symptoms caused by other drugs, including other medications, rather than addressing the root cause of the problem. According to Gray, the doses themselves may be exposed health risks for some people. One of the biggest concerns with gabapentin is high prescribers who go to take this medication, doses with other adults or patients taking multiple medications. Gray said, additionally, gabapentin is broken down by the kidneys and as well as age. Their kidney functions decrease. So she said, as may occasionally, when a patient kidney function has dropped, the patient's dosage has to drop. So while far and few people get addicted to gabapentin, then opioids or benzoprine, the risks accrues for those who have used drugs and alcohol. So people who are dependent and people who have opioid disorders, severe states now consider the drug a Schedule V controlled substance. So Schedule V drugs have a lower risk for abuse and dependence, but still requires a prescription because of the potential to cause addiction. I have seen requests for higher doses and evidence of non-medical use, says medication. It is associated with breathing problems. And for those of you who already have like problems with breathing, this is something that you should bring up to your attention to a medical provider, and do not keep taking this medication. Discontinue this medication and speak with your local pharmacy about this medication, because this is a serious FDA problem. I don't even know why they have it on the market, probably because it's selling like crazy. Anyways, you guys, I hope you guys enjoyed this video. I will be creating more YouTube content as I go, and I hope you guys enjoyed this weekend as things flow by. I know that time has flown by. It's been crazy, but yeah, I just wanted to add on to that. And you guys, I hope you guys enjoyed this weekend. Until then, have a good one.